Hi, I'm Robin. I'm not sure exactly how to start this. I guess right now I'm going to start by telling you a little bit. Hopefully, you read my testimony so you know how I came to Christ and how I became a follower of Jesus. And so let me start telling you about my cancer and how that all came about. As you can tell, I'm still at the very beginning of my journey. Back in mid-June, late June, I had found a lump under my left armpit, and it was about the size of my thumb, about that long and a little bit wider than my thumb. And so, of course, I found it, went straight to the doctor as soon as I possibly could get in. And he ordered a mammogram and blood tests and everything. So we started testing. Poking and prodding started. And blood test came back, everything fine. I was hoping so much for my blood test come back with a high white blood cell count. Maybe it's an infection I've got somewhere in my body that is being filtered out by the lymph node system. But all my blood work was fine, which was in a way a blessing because my liver's good, my kidneys are good, all the internal organs that are doing their job, and they're doing it good. So I praise God for that. When we went in for the mammogram, it was on a Monday on the 1st of July. And I went in for the mammogram in the morning, and they did an ultrasound of my complete breast and my armpit, both armpits, to look for swollen and blown up lymph nodes. And I ended up having a biopsy. Talk about, that really kind of threw me off. And having the biopsy, it was a ultrasound biopsy, and I had to lay on my right side and lift my arm up while a lady behind me did the biopsy needle and gave me the local numbing, and the lady in front of me took care of the ultrasound, and then I had another lady holding my hands. I think in this small little room there were 5 people besides me. So they got me numbed up, put in the needle, put in the apparatus they use to put the needles through to get the grabber thing into my tumor. And the first 3, they were taking a total of 6 samples. The first 3 were okay. Didn't hurt, pretty relaxed. A little tense, wasn't doing too bad. But that 4th one, they went in, and when they take the sample, I could see it on the screen, this thing going into the tumor. And then I'd hear this click, and they'd pull it out. And they went and that 4th one put it in, and clicked, and I had shooting pains coming into my chest, into my breast area here, and it was like this muscle here just cramped up and just did not like it. It was pretty painful. Poor lady behind me that was doing the procedure, she about jumped through the roof. 5th one was fine. They gave me some more numbing after that one that hurt, and 5th one was fine, but the 6th one did it again. They didn't even get to the click before I ended up with shooting pains down the underneath of my arm here from my lymph node. And that put me really through the roof. And she jumped, and it took a little bit for them to actually get that sample. So Um, they got that last sample, got done, and it took me, 10 minutes before I could sit up. I was shaking so bad, and I was in such pain. So it just, you know how when your body goes in, well, I don't know if you know how, but when your body goes into shock due to a traumatic incident, which to me this was, it just goes into the shaking mode and it doesn't want to stop. So it took me about 15 minutes before I could sit up and even think about getting on my feet. So I did this by myself. I wasn't expecting to have all this procedure done, and so I went home and waited, and went through the week and waited, and on Saturday I hadn't heard anything yet, and I was in still quite a bit of pain. And so I went in to the doctors to get some pain meds, to something to help me, because I was having a hard time sleeping. It's like taking all that tissue just astrabated what was going on. Before that, I wasn't in a whole lot of pain, but because of that, trying to roll over and sleep at night. You get your arm up here like this, and it just trying to use my arm to roll over was extremely painful, still is. So got through that, but I went into the doctor's office that Saturday, and he didn't want to call. I actually called on Friday, and he didn't want to talk to me on the phone. So I went in, partially to get some help for pain and to get the results of the test. And he walked in and he looked at me and said, "You got cancer. It's positive for breast carcinoma." And I kind of had a little teary, kind of like I am right now. And he looked at me and he goes, "You knew it, didn't you?" I said, "Yeah. I was pretty sure when the blood tests came back that it was going to be cancer." But like I always say, it's all good. You know, God's got it all. It's just put it in His hands, and He'll take care of it. He'll carry you through. So the praying started and stuff. So it's after that. We went ahead and set up an appointment for the surgeon. That was the first step, because Dr. Sama knew that it needed to get cut out, so he got me into the surgeon first. And so we did some more testing. I went and had some genetic testing done to see whether or not I was genetically had a genetic gene, a BRCA1 or BRCA2, I think is what they call it. And those are the genetic markers that genes that carry breast cancer onto further generations. So, and I also got the results back from the biopsy and got that results back. I've seen my oncologist. We've talked about surgery and all the steps I'm doing. So let me back up just a little. So there's been a lot of testing going on. I'm not going to go through each one step by step, but there's been a lot of testing. So far, the breast cancer biopsy put me at a triple negative. There are 3 markers that they look for in breast cancer, and I don't have any of those. So that means it's harder for them to do a specific drug regimen for them to pinpoint how to stop feeding and start killing the cancer. Okay, so that's kind of makes things a little more difficult. I had a radioactive sugar test done. They call it a PET test, and that's when you go in and you sit and you fast so that your blood sugar is fairly low, and then they give you this radioactive sugar, and they shoot that into you, and then they let you sit and let that go out round, and they put you in a tube and take pictures of you. And so on that test, I came back with no cancer anywhere else in my body. Praise you, Father, for giving me a healthy body. All my functions are good, no cancer anywhere else, which is just such a blessing. So many women go through so much more than I am. Then we did the genetic testing, so I'm negative on that. I do not have those genes. Now we're moving forward. I am doing a trial here at Smilow Cancer Center here at Yale is where I'm at. And next week all that starts. I'm going to be getting an immune therapy drug along with my chemotherapy. And so that's kind of where we start, where we're at right now. I've gone through all the testing, and now I'm kind of in wait mode till next week to be able to start treatment. I'm going to be getting a stent, which is a thing that's going to go into my vascular system here on the opposite side of the cancer, so that they can give me treatment and take blood on a regular basis. I have to have another biopsy next week. I'm not looking forward to that. Starting chemo and just kind of getting things going. So that's kind of up to date as to where I am medically. I am going to leave it at that for now. I've only got 15 minutes on this recorder before it's going to cut me off. So we're going to do this in 15-minute shots. And so that's where I'm sitting. So far, I praise God. He has brought me to a really good place where in my church I have a really good support system. I just moved in with, I'll get into this next time. There's so much praise to give God through this that if I started now, I'd run out of time. So for now, I'm going to say see you next time. Be praying for me. I'd appreciate it. But also in the way things are going right now, pray for Texas, pray for Florida, pray for the Keys and all the problems, the fires in the Northwest. There are so many people going through so much more than me. But definitely praise God for all the goodness in our life. Thanks.